Hello everyone and welcome to Supporting School Communities in the Context of COVID-19. I'm Ciara DeLucre, Team Leader for the NEPS Kilkenny team. You will hear from several psychologists from Carlow and Kilkenny throughout the presentation. We've explored information on psychological first aid and drawn together advice that you and your school may find helpful in the coming weeks and months as we all move forward to a new normal. As this is a pre-recorded presentation, there are details later if you need to forward any questions or queries you may have. Intuitively, you may be using parts of the psychological first aid already. We hope that the structure and the steps that we illustrate for you will be helpful. In March, the government made a decision to close all schools in Ireland in order to slow down the spread of the COVID-19 virus in Ireland and keep as many people as possible safe and well. Our young people, who are generally active and social, have been asked to stay at home. Some students were ready to take on this challenge of staying at home. Some may have become bored and fed up, and others may be feeling worried or anxious. There are ways to support students in your work with them while they adapt and adjust to this challenging time. This is also a very challenging time for you as teachers, trying to balance home responsibilities with work responsibilities, trying to learn new IT skills, and trying to prepare exam students, communicating with parents and students who may be distressed. There may be times that you need additional support, and you may wish to talk over a problem or an issue with someone. You can contact the EAS service for teachers. The number is on your screen. Inspire on 1800 411 057. They also have an interactive digital hub with lots of great resources and advice. As teachers, you can indirectly support parents by supporting the students also. By guiding pupils, using the advice provided, and by your own skills and professionalism, you are indirectly supporting parents. There may be times that parents need additional support and may wish to talk over a problem or an issue with someone. You can advise them to call Parent Line on 1890 92 72 77, and the number is on your screen. NEPS has developed a number of resources which can be found on the Department of Education website. These include teacher wellbeing and self-care during COVID-19, guide for parents supporting children with routines, advice to young people when schools are closed, sample and blank plans for the day, and relaxation techniques both in text and podcast. While these have already been issued to schools, it would be useful to ensure that you're familiar with the resources so that you can remind students and parents to use them should the need arise. There is a lot of information out there, but sometimes people need direction to trusted sources for a particular need, and sometimes people need to be reminded of resources that have been previously given. A number of these resources have also been animated and are all available on the department's website. These are some of the NEPS resources that you may be familiar with, and again are available on the Department of Education website. These are the frameworks for our NEPS practice. Responding to critical incidents has been updated to meet the current needs of our schools. Student support teams in post-primary schools, wellbeing policy statement and framework for practice, wellbeing in primary and post-primary schools, and other documents that we refer to include the HSE psychological first aid training, from their guidance document on psychosocial and mental health needs following major emergencies, and we also refer to the document from the World Health Organization Psychological First Aid Guide for Field Workers. Firstly, during this presentation, there will be an overview and an introduction to what psychological first aid is and why we might use it, followed by how we might use BFA with students while promoting our own well-being and self-care. Psychological first aid can be a helpful tool for you as you support young people and their families in the next phase of our COVID-19 story. I'll now hand you over to Anita Purcell for the next part of the presentation.
Thanks, Ciara. Psychological First Aid, the Guide for Field Workers, is a World Health Organization publication. It's endorsed by 24 UN and non-government organisations, and it's available in a number of languages. It's based on a huge body of international research. So if you'd like to read the full document, you can download it for free from the World Health Organization website. If we look at this graph, we can see the various needs during a crisis. And at the beginning of a crisis, you can see that the medical needs, which are shown in the red line, are heightened at the start. By medical needs, I mean access to contact tracing, PPE, hospital beds, vaccines. Also, at the beginning of a crisis, the practical needs are quite high, such as access to the COVID-19 payment from the government, food, guarded checkpoints, social distancing, etc. These then decline during the course of the crisis. However, you can see then that the psychological needs begin to increase. So they were lower at the start, but they increase as the crisis goes on. And they are things such as bereavement, loss, trauma, people living in very difficult domestic situations. So this next picture illustrates quite nicely, I suppose, how the psychological footprint or impact after a crisis is often much larger than the medical impact or footprint. So what is psychological first aid? It's a safe and humane response to people who are suffering in the context of exposure to a serious stressor. So it involves a non-intrusive practical care and support, ensuring that individuals' basic needs are met, such as food, water, shelter, listening but not pressurising people to talk, comforting and helping people feel calm, helping people connect to information, services and supports in their area, and ensuring people's safety, particularly that they are not isolated from others. So in summary, psychological first aid is a normal human connection to someone who is distressed, using a warm, empathetic, humanistic approach. So who needs psychological first aid? So not everyone who's experienced a crisis event will need or want psychological first aid. There is a continuum level of need. Some will be more resilient than others. Likewise, there are others who need more advanced support than PFA alone. Examples include people so upset that they cannot care for themselves or others, people with a known mental health history or identified risk, or people who may hurt or endanger the lives of others by not abiding to the public health instructions. So in a school context, this might look like pupils who've experienced an unexpected reduction in their academic performance, pupils talking about suicide, pupils showing discipline problems, children withdrawing from extracurricular activities, or neglecting their physical appearance. So, psychological first aid is not something only professionals can do, though professionals can and do use it. It's not professional counselling. It is not psychological debriefing, which has in fact been found to be ineffective when used after a crisis. It is not a detailed discussion of the distressing event. It is not asking people to analyse events, and it is not pressurising people to describe their feelings or reactions, though it does try to establish a safe setting to enable people to tell their story. And telling our stories is so important because it gives children and adolescents, and us as adults, an opportunity to retell our experience of the pandemic, and this can help us manage the trauma of it. Retelling our experience, it helps us process it, I suppose, which can make the experience much more tolerable. So as a teacher, why should I use psychological first aid? Well, this slide shows us that by using it, people do better in the long term because they are made to feel safe, connected to others, calm and hopeful, have access to social, physical, emotional and educational support, and it allows them to regain a sense of control by being able to help themselves. So teachers can offer psychological first aid to their students immediately after a crisis or in the weeks and months following the crisis, depending on how long the event went on for, and it can be delivered in a school setting, ideally where you've got some privacy. Keep it confidential if at all possible, if this is appropriate. Okay, so I'm going to hand you over now to my colleague Valerie Dones, who's going to talk about psychological first aid in more detail.
Thanks, Anita. So I'm going to talk you through the PFA principles and discuss with you some of the areas that need to be covered if you are supporting a person using psychological first aid. Just remember that as a school staff member, you're most likely using these principles already in your general chats with pupils that you might be concerned about. Or as Ciara mentioned earlier, you might be using this intuitively. So this is taken from the World Health Organization, and it looks at psychological first aid using the following steps. So the first thing you should do is prepare. This means taking time to think about the situation, to learn about the facts, and to have a list of services available for the young person you're talking to. Next, you can see we have look. It's important to have a look around and see who may need support, who does not appear to be coping in the current climate, and who may benefit from speaking about their situation. Following this in yellow, we have listen. Listen involves meeting somewhere privately with the young person and just being present with them. Taking time with the young person to talk about any concerns they have allows them to feel calm. And really at this stage what you are trying to do is just allow the person to calm down and just be present with you. So listening properly to people you are helping is essential to understand their situation and needs. Last is link. At this stage, really what you're doing here is you're linking the person with practical supports. And this is really critical to psychological first aid, is linking. So this may involve linking them with other services locally or reminding them to connect with their own supportive people such as friends and family. The following slides will explain to you each step in more detail. So on this slide here, we have the look stage. Anita might have mentioned some of these behaviours that you might see earlier. So at the look stage, you're looking out for just different behaviours. You might be looking around your school to see who needs support when you return in September. So some signs here are outlined above that may be indicators that someone isn't coping and needs support. So people may be presenting with some physical difficulties in that they appear tired or restless in the classroom. Some may present with mood changes, so they might be changing from happy to sad or calm to angry within the classroom or school environment. Others may start to avoid meeting their friends, or they may fall behind in schoolwork, and others may be just struggling to concentrate in class or thinking very negatively. Remember, everyone responds to situations differently, and it's important to normalise all feelings when you're meeting with a student. Remember that some students are likely to present as more vulnerable during stressful times, as their understanding and coping skills will vary. So some students, you may need to consider supporting the ones that are listed below. So students such as those with autism spectrum disorder, maybe students with learning difficulties, those who have communication difficulties and may not be able to communicate how stressed they're feeling. Cultural differences or physical and health difficulties, those with difficult family circumstances where maybe they're not getting the support they need at home. Recent bereavement is another thing, and finally social isolation. So these are all the students that you might maybe need to give a bit of consideration to when you return to school. The next stage we have is listen. So this is stage 2. At this stage, it's important to approach the person that may need to talk. Remember that listening to another person means that you need to be totally present with them in order for them to feel safe and calm. You can start by finding somewhere quiet in the school to talk. Then try and support the young person by finding out what their concerns are and what they might like help with. Remember, it is important that the young person may not want to talk about their concerns, and that is okay. If the young person is really upset, help them to feel calm. So what some students may be feeling is that it's a need to do some breathing exercise or relaxation strategies before they start to speak with you. It may be a good time to speak to the young person about their strengths and discuss times they've been resilient in the past. Remember not to give your opinion or pressure them to talk at this time. Also important not to tell someone else's story or make false promises. And last we have link. So link is the last stage of psychological first aid, and here what you're doing is linking people with practical supports, and it's also a key part of psychological first aid. So you might discuss the supports available to the young person, such as their family or friends, or even some useful websites that they might avail of. At this stage, you're trying to help the student to help themselves regain a sense of control. You might encourage them to keep a routine in terms of their sleep and the activities they participate in. You might encourage parents, if you're speaking afterwards, to remain supportive and remind them to monitor conversations they might be having. Another thing to remember is to keep in contact if this is something you feel is necessary. So arrange another meeting with the student. So in order to end the psychological first aid, you need to consider the student that you're meeting with and consider whether they need to meet you again. So you're using your best judgment of the student and the situation. You also may need to consider your own needs and see if it's suitable for you to do psychological first aid with the student again. If you feel the need to make contact with the person again, that's totally fine, but just arrange a time and date and make sure they know where they're meeting you, if they're going to meet you again, and what time and date that will be at. So at the end here, guys, we have 3 L's. So look, listen, link. And last here we have another slide that's taken from the World Health Organization Psychological First Aid. And this is just a short slide as a tip sheet for things that caregivers can do to help their children. So at the infant stage, if you're meeting with someone who's presenting, a child that's presenting is very anxious, remember in the classroom or school environment, maybe keep them away from loud noises and chaos. Lots of contact with you, and for parents to keep regular sleep schedule if possible. If you're around the child as much as you can, speak in a calm and soft voice. For young children, give them extra time and attention, so checking in with them regularly, reminding them often that they're safe. Explain that they are not to blame for anything that may have happened or any of the bad things that may have happened, because some children may worry about this. Keep regular routines again and schedules as much as you can, and give simple answers about scary details. Provide a chance for children to play and relax, and this is really important. For older children then, what you will do again is give lots of time and attention. Routine again is key here, so keeping routines as regular as you can. Sleep again is another important factor, and trying to keep a regular healthy sleep routine going is key. Allow students to be sad, don't expect them to be tough, and listen to them. Listen to their thoughts and fears. Setting clear rules and expectations is really important for teenagers, as this is how they feel safe. I'm now going to hand you over to Sheila Keane, who's going to talk to you about self-care.
Thank you, Valerie. Returning to school in the current climate brings with it a lot of uncertainty and unknowns. You as teachers may be feeling a bit more stressed than usual. In this section, I will address teacher self-care. The key message here for staff is that in order for you to be able to support students effectively, you need to pay attention to your own well-being and to feel well in yourself. So we're reminded of the oxygen mask on the airplane scenario, where the air hostess says to adults to put on your own mask first before attending to children. Remember, people do not respond to stress in the same way. Feeling stressed is not a sign of weakness or a reflection that you cannot cope with your job. Stress is a normal response, especially at times of uncertainty and unpredictability. And some people cope better than others. It may be beneficial to think about the strategies that have worked for you in the past. Our strategies to cope tend to be the same even if the scenario is different. So firstly, when it comes to looking after yourself, you've got to consider your physical health and your basic needs. At times of stress, people often forget or underestimate these needs. So consider your diet and ask yourself, are you eating healthily and regularly? Try to avoid or minimize your intake of alcohol, caffeine and nicotine. Try to ensure that you're getting sufficient rest and breaks during the day and that you're sleeping well. Try to maintain a good work-life balance, where in the evenings you're going home, you can switch off, probably switch off technology and try to do something creative or something of interest to you. It's also important to get some exercise and engage in physical activity. As well as looking after your physical health, you also have to consider your emotional well-being. For this, you need to be able to recognize when your body or your mind is feeling stressed. What signs are there that you're under pressure? Do you have a headache? Do you find that you're sleepy a lot of the time, or that you can't pay attention for long periods? When you feel stressed, it's important to use deep breathing or mindfulness activities that will help you to relax and let go of your worries even for a short time. The Basic PH webinar, which is available also on the Kilkenny Education website, gives more information to schools and teachers about coping and resilience. Remember, we are social beings, so having contact with others can help us to cope as well with stress. This means then in your schools, your relationship with your colleagues can be a support at this time. As a staff group, try to set aside time to talk to colleagues, to find out how they're doing, share your concerns, watch out for and support colleagues that may need extra help. For principals, it's important to allow time for your staff to connect and catch up with each other. Also, it's important to ensure that there's an effective communication system so that all staff members are getting accurate information all the time. Some teachers may find it more difficult than others to cope. If it's a case you're having persistent upsetting thoughts, if you're feeling very nervous or extremely sad, if you're having trouble sleeping, or maybe using alcohol or other substances to help you cope with stress, you may need extra support. If this is the case, you can consider calling the Employee Assistance and Wellbeing Service on 1-800-411 057 or email them at workandstudy@inspirewellbeing.ie. This is a 24-hour confidential counselling service. If your difficulties persist, it may be beneficial to contact your GP. Finally, take a moment to reflect. What do you do to take care of yourself? Or maybe you need to change things so you are taking care of yourself better. Also, as a staff group, what do you and your colleagues do to take care of each other? Thank you for listening to this presentation. If you have any questions related to psychological first aid, you can email these to Janet O'Grady at education.gov.ie or contact your NEPS psychologist directly. Thank you.